According to the CDC, glaucoma is the second leading cause of blindness worldwide, and in people over 60 years old, it's the leading cause of irreversible blindness. Dr. Ryan Vincent with the Wolfe Eye Clinic joins us today to talk about this. Thank you so much for being here. We really appreciate it.
Thank you for having me. It's nice to be here and try to get some awareness about glaucoma out there.
Well, first of all, tell us about glaucoma, because there are different kinds of it, right?
There are. So glaucoma is really a group of disorders that all have the similar basic effect of having nerve damage on the optic nerve, which can affect vision and cause vision loss. The underlying theme for most of glaucoma is elevated pressures, but we do know there are patients that can have elevated pressures without glaucoma damage. And similarly, there's patients who, even on screening with normal pressures, can actually develop glaucoma. So it's really kind of a group of disorders with an underlying theme of nerve damage. And that's one of the things that's scary about glaucoma. Because it causes nerve damage, any vision you lose from glaucoma is permanent. So one of the keys is really awareness and early detection so that we can adequately treat.
Yeah, what are some risk factors for developing this?
Well, a lot of the risk factors, unfortunately, are things that we don't have control over. And some of the big ones, as you mentioned in your opening statement, over the age of 60, there's increased risk. And so really age being a significant risk factor. Family history and genetics also plays a significant role. So a first-degree family member with glaucoma does confer about a 4 to 5 times increased risk over the general population. So those are some things that we can't do anything about. And there are some other diseases and medical issues that can potentially put you at higher risk for glaucoma, like diabetes as an example. But the other big risk factor is intraocular pressure. And intraocular pressure is one of the things that we can control potentially with treatment. So for patients who have an elevated pressure, that can be caught upon screening, even with your local eye doctor. And that's something that we can modify risk long-term to try to prevent vision loss. So that's the key.
You mentioned screening, and we can see, anyone who's been to the eye doctor can see those familiar tools behind you. How often should we be screened for this?
Well, for most patients, an annual checkup is reasonable. There are certain situations where if there's a strong family history of glaucoma, or if there's pressures that are elevated that we feel need to be monitored more closely, we'll recommend that. But for the vast majority of patients, an annual checkup with their local doctor is adequate to catch glaucoma early and be able to effectively treat and prevent vision loss.
And speaking of treatments, are there new treatments that can help with this?
That's one thing that's great about being in the glaucoma world. There have been a lot of recent advancements, and over time in my career, since I've been practicing over the last 10 years, we've seen new medications come out. There's multiple different procedures that have come out. So it's really a fun time to be working with glaucoma patients. But for the vast majority of patients, treatment involves using an eye drop, which will effectively lower pressure and prevent progression of the disease. And for reasons that we talked about, with this being a nerve disease, there's really no cure for glaucoma, but it is very treatable. And so for most people, that means drops. But there are situations where when drops fail, we consider other treatments like laser, which is an in-office procedure which can lower pressure. And there's surgical procedures, which there's also been a lot of advancements with new devices and treatments to lower pressure, which can allow some patients to be effectively controlled without having to use drops.
Dr. Vincent with Wolfe Eye Clinic, thank you so much for being here to talk about this really important topic.
Well, thank you for having me. It's great to get the awareness out there, and certainly give us a call if we can be of any help.
Wolfe Eye Clinic has glaucoma specialists to help you out. You can learn more and find a location near you at wolfeyeclinic.com or call 833-474-5850. You'll find Wolfe Eye Clinic in West Des Moines at 6200 Westtown Parkway. We have an event for you and your kids that's happening in over 9 days with 150 free activities. Find out how you and your family can get in on the fun right after the break.